Hi. We'll wait a few more minutes for some people to get on here. There we go. It's 8 o'clock. My name is Dr. Megan Elminger, and I'm a chiropractor at Revive Precision Chiropractic in Omaha. Prior to starting the practice in Omaha, I actually practiced in suburbs of Minneapolis for about 6 years until I had a concussion of my own. And so in clinical practice, I saw many concussion patients. A lot got better, and I really didn't think anything of it until I had my own motor vehicle accident where I sustained a concussion, and the impact on my life was huge. And so tonight, I really want to talk about the long-term effects of a head injury, because we know that short-term symptoms can resolve rather quickly, but we also know, because of what's coming out in NFL and NHL, and some of those players, what the long-term consequences of concussion are. And I think one of the biggest problems with concussions in particular is that they are a traumatic brain injury. They're a minor traumatic brain injury, but the problem with just a concussion is that people assume that you're just going to get better. And when you really talk to head injury and concussion patients, it's not uncommon to find that that's not the case. And so what happens is you don't necessarily have to have a really severe accident in order to have severe symptoms. Sometimes it's one-to-one, and sometimes you have a really minor accident and really severe symptoms and you're not healing for a long time, and sometimes it's vice versa. And so what we really want to do tonight is talk about the 3 things you must do. And number 1, I think people are doing a fantastic job of awareness. High school sports programs, youth sports programs, they're all really educating parents on when not to put their kids back in the game. I think the one area that there's a big gap in is, are you sure, number 1, and number 2 is the people who played youth sports decades ago, and I see them in my office with what I call snowball health issues, meaning they'll relate to me that they had motor vehicle accidents or sports accidents, and then these are the people who are on 5-6 medications. They have pain all over, chronic low back pain, migraines still 3 to 4 times a week, and if anybody's had a migraine, you know there's a huge impact on your life there, and we have another webinar specifically on that coming up soon, so we'll talk more about that then. But my mission is to heal the impact, and what I mean by that is the impact itself can cause a head injury, brain injury, and concussion, or even a severe traumatic brain injury. But the impact on the person's life, the impact on their family's life is also huge. Just psychologically, because of their inability to control emotions, financially, because they're not able to work or function as they once were. And sometimes these problems are just under-addressed. And so hopefully through this seminar, we can get through some indicators which may or may not indicate that you need to be in someone like myself's office. And so what we're talking about is big neurological issues, but not like the neurologist measures. The neurologists do a fantastic job of making sure your brain and spinal cord are intact. What I do in my office is make sure that it's modulating, so acting like the gatekeeper, sending and receiving appropriate signals. And that's what your brainstem does. And we know your brainstem does that. It's called the autonomic nervous system regulation. And your autonomic nervous system is that which controls your respiration, your heart rate, your blood pressure, things that you don't have to think about on a day-to-day basis, but most definitely are important in our health and vitality. And so I look at the brainstem and I look to see if there's neurological interference. But what I'd first like you to do at home, if it's you, you might need to grab somebody else to help you with this. But if it's you, your family member who suffered a concussion or multiple concussions, there's 2 simple tests you can do. The first one is they can stand with their feet together on the floor, and then they're going to close their eyes. And you may need to have your hands around them a little bit if they do really have a severe reaction to this test. And what you're gonna see is when they close their eyes, they may start swaying side to side slightly like this, or forwards and backwards, and the direction doesn't really much matter. It just is an indicator that the brainstem is not catching on quick enough to appropriately relay the signals of where the body is at in space. So think about when you have a head injury, you have, boom, your head goes back, and we know the brain hits the skull, and that causes damage directly to the brain through a head injury. But then the spinal cord also gets damaged, because you can't have a brain injury without having the spinal cord, which sits in these top two vertebrae, being injured, and then the muscles and ligaments around it. But specifically, we're talking about the brainstem, which runs in these top two vertebrae here. And so we know if we have the brain has an injury, the brainstem has to have an injury by mechanism and by the forces required to have a brain injury. But oftentimes the brainstem, there's just not a whole lot of specific testing that can be done. So number one, we're going to test, are they swaying with their eyes closed, and you may need to catch them. And number two is going to seem much like a sobriety test, and it really, in fact, is. And so if you can take something like a pen, what you're going to do is you're going to go side to side, and you're going to cross, and the person's going to follow the pen. They're going to follow it up and down, and you can make an H, and then you can come in towards their face. And what you will see if there's an issue is that as the pen gets to the end, their eye will follow, but it will flicker like this. And what that tells us is that the cranial nerves have some issues within the brainstem of controlling this eye movement. And so you'll come over, you'll get bouncing. When you cross the midline, you might get kind of like a jerking, bouncing motion. But if you see that, we know the brainstem is having issues, okay? So it's not just that your eyes are bouncing, and it's not just let's retrain the eyes to be strong. There's a deeper issue, if you will, which is involved with brainstem interference. So we can talk neurological interference, like the neurologist tests, and a lot of times MRIs, EEGs, which measures brain waves, are normal, which in my opinion is fantastic, because I want you to be as healthy as possible. But when we see minor indicators like this, just think of what it does over time. Exponentially, you go from here and you can just snowball, and you can get worse really, really fast. And that's why we're seeing all these issues which seem to snap and come up in NHL and NFL players who have a chronic history of head trauma. And speaking of chronic history, as in with anything, you can have big traumas and you can have little traumas. And you could have lots of little hits, like you hit your head on the counter and had a zinger. You were playing backyard football and had a zinger, you were seeing the stars. Or you could have you were in a car accident, got knocked out kind of injury. And so it doesn't really matter, because the minor ones can add to be big ones, and the big ones, if that's your first one, you could recover faster. So there's a number of history indicators that we need to pay attention to too, but really I'm looking for indicators that there's inflammation in the spinal cord, which I do through thermography. I'm looking at the x-rays, how are you moving, because we know that when you have an injury like this, it's going to cause damage. And then we're also looking at these other small indicators, which I just taught you how to do. So one more thing I want to describe about the nervous system, and my patients find that this is a fantastic way to understand what it is that I'm doing when I'm adjusting you. And so if we think of your brain and your brain stem, and then it goes out to your nerves, it's supposed to travel in waves like this. But what happens is a lot of times we get tension on the spine, and so it gets taut like this. And then what happens in this mechanism of injury with head injuries or other injuries is, think of, we have torsion as well as tension, and you can see that right here in this area down lower from where I'm providing the torsion is actually getting messed up, and there's definitely not much waveform. And so what I explain is I release that up top, and you can see it restores the normal motion. And so this is a fantastic way to illustrate what it is exactly I'm doing when I'm adjusting you. And speaking of adjustments, people ask, well, what chiropractor do I go to? How do I know they're a good chiropractor? And all I would say is objective indicators need to be there for you to have an adjustment. So if your chiropractor is not taking objective indicators such as thermography, x-rays to show how you're moving, and they show inflammation and they show this tension and torsion is there all at once, then I would not go to that chiropractor. Because every force that we put into your upper cervical spine, your body also has to react to. And so what we really don't want to do is add more force than necessary. We want to allow that gap of time for your body to heal. And we know that that's the most frustrating thing for you. It's the most frustrating thing for us as doctors, that we have to have time to heal. But really, as and Dr. Andy Roberts, who is a dear mentor who just passed away, said the magic happens between the adjustments. And so when I adjust you, when I remove that tension and torsion in your spine, we can restore the normal flow of nervous system signals, which are modulated by your brainstem. So that ANS that we talked about, the autonomic nervous system, which so often gets damaged in brain and spinal cord injuries. And if you ask psychologists, if you ask medical doctors, they know the ANS is affected. However, their treatment means are not what I can do as an upper cervical specific chiropractor. And so I would suggest, if you have those two indicators on those simple home tests we talked about, that if you're still having symptoms, that you really need to get to a chiropractor to evaluate this, because the impact on the longevity of your health and the connectedness to your family is going to be in danger. And what we don't want to do is wait for the emergency. We don't want to wait for the fire, because then it might be too late. It might take a lot longer to heal. And so I would much rather see people in my office early who we are seeing these indicators with, who have had an impact, to rule out the brainstem issues as well. So I hope you've learned a little bit tonight. I know we went super quick. I know I talked super fast. But we do have the migraine seminar coming up soon. You are more than free to contact me. And if you are having these indicators, please, please schedule a consultation or an appointment in my office so that we can make sure that you are on the path to health and healing, given enough time.